The most important thing in treating seborrheic dermatitis is to eliminate the patient's discomfort. That is, to address what bothers them, itching, the presence of crusts, right? This flaking, for example, it's both unpleasant and cosmetically speaking, aesthetically, well, not attractive. That's why when such eruptions appear on the face or scalp, you really want to get rid of these problems as quickly as possible. So what works most effectively? Well, solutions are recommended. Solutions for the scalp, the Presaric works very well. It doesn't make the scalp oily, the hair doesn't get greasy, and it also comes in the form of an aerosol which is used to treat the area, and in this way all these crusts are shaken off. As for the skin, we usually use a 1% clotrimazole solution. It has proven itself well on the face and body since it is very gentle and comfortable, and at the same time disinfects without irritating the skin. That's it. It works very well against fungal as well as both aerobic and anaerobic infections. The Presaric ointment is typically used for about 5 days on the face and the scalp to help gently remove and exfoliate. It contains salicylic acid, which exfoliates and removes very well so that keratoregulating agents can be used afterwards. That's it. And then after Depresaric, you can use ointments or creams like Trimisting, Triderm or Dermazole for about a week. That's it. For chronic cases like this with a lot of crusted eruptions and itching, additional treatment is recommended besides topical therapy. These are immunomodulators. Cycloferon and Immunofan have proven to be very effective. That's it. Polyoxidonium also works very well. And if there is pathogenic microflora present, considering that this is a microbial fungal infection, antifungal medications from the itraconazole group are prescribed either itraconazole itself or itracon. That's it. The treatment is selected individually in terms of dosage for each patient. The most important thing in treating seborrheic dermatitis of the scalp is choosing the right shampoo. This is already the first step and the key to proper treatment. Since the skin of the scalp, yes, in cases of seborrheic dermatitis, is most often oily, though sometimes it can be mixed. That's why the selection is done individually. There are different shampoos, Freedom shampoo with zinc, Olga Pix shampoo, but these are most suitable for oily skin. Very pleasant and comfortable shampoos are suitable for all skin types, specifically for seborrheic dermatitis. That's exactly what they're called, specifically for seborrheic dermatitis. Brands like Ducray, Item, these are also from Item and the Urich brand. Excellent shampoos. They exfoliate very well and restore the skin's lipid barrier. Now, regarding an interesting product, there's a new release from Urich's. This product works as a DS lotion at the same time. It exfoliates perfectly, relieves itching and moisturizes. It works both on the scalp and on the skin. So it's excellent even for something like relapse prevention treatment. In other words, it's a wonderful product based on thermal water and it's non-hormonal. This is something to keep in mind, and definitely make a note of this for yourself, that such a product exists. But in addition to medication, of course, there's diet, proper nutrition and hygiene. Also, as home recommendations, what you can do on your own, A very good decoction, you can use that as well. Burdock root, hop cones, nettle, tansy. Mix all of this together. Yes, 1 tablespoon per liter of water. Well, if you need a larger proportion, then make more and rinse your hair with it after washing. What does this do? First of all, it promotes hair growth, soothes the nervous system, helps have a calming effect, and tansy and nettle cleanse the skin. The sebaceous glands open up and the skin starts to breathe. So it's an excellent remedy. These are the kinds of recommendations you can add for home care.